Hello, everyone. Welcome back to the Fringe podcast. I'm Dr. Abby Kramer, the medical director at Fringe, and I'm here with the lovely Dr. Genevieve Newton, our scientific director, and we're here to have a conversation about vitamin D because it is the season.
Yes, ma'am.
All right. So, Jen, can you please tell us a bit about vitamin D? I feel like everyone has heard about it, but just so our listeners can better understand what exactly is vitamin D and what's its role in the body.
Yeah, because it's actually a confusing one compared to some of the other nutrients that we have to intake on a daily basis. So, okay, let's start at the basics. Vitamin D is what's called a micronutrient. Those are our vitamins and our minerals, meaning we need them in very small amounts, but they are essential for health, and many of them, are literally essential for life. So, um, we get into this micronutrient category of vitamins. And then we also have a division between water soluble vitamins and fat soluble vitamins. So vitamin D is a fat soluble vitamin, which actually means that, in fact, we don't necessarily need to take it in on a daily basis, which we certainly do recommend that you do, but your body stores fat soluble vitamins for a period of time as well. So water soluble vitamins will be excreted quickly, fat soluble vitamins will be stored. Now, everyone's probably heard that vitamin D is called the sunshine vitamin, and that's because unlike other nutrients, we have another non-dietary source of vitamin D. And in fact, this other source of vitamin D is in fact the dominant really source throughout our evolutionary history. Meaning, when we are exposed to the sun and it hits our skin, there's this chemical pathway that takes place by which vitamin D essentially gets synthesized in the skin and it gets transported throughout the body, and it can do all of these amazing things that we now know it does. So, really, we can say that we have three sources of vitamin D. We've got food, we have sunshine, and then this third source is where Fringe comes in that is that we have supplements as an additional source of vitamin D. We need an additional source of vitamin D because dietary intake and distribution in food tends to be very, very low. We'll talk about that probably in a little bit. Another reason why we need it is because, for example, you and I living in cold climates, northern latitudes, and we don't get enough exposure to sun. Even people who do live in climates where they can have sun exposure during the day, many of them are working indoors or they're wearing sunscreen, they're limiting their sun exposure. So we tend not to, on aggregate, on a population level, get very much vitamin D either from our food or enough from sunshine. And so we end up needing this additional intake of vitamin D through supplements. In terms of what it does in the body, so historically speaking, if we were to go back into the early 1900s, people really recognized the importance of vitamin D because it became very obvious that when individuals didn't have it, they ended up with this skeletal deformity called rickets. And so you would see these children that would grow into adults with this deformity where their legs bowed out. That was because their bones were essentially soft from a lack of dietary intake and a lack of sunshine. And so for many, many years, the scientific community and the medical community really focused on vitamin D as being essential for bone health, which it absolutely is. But in the meantime, we entirely missed the boat of recognizing that it was actually involved in all of these other biological processes as well. And really, I would say that at least as important as its role in bone health, and perhaps more so, is its role in regulating the immune system. So it's a primary regulator of the immune system. And if we look at the genes in the body that are regulated by vitamin D in some way or another, there are hundreds of them. There are so many biological processes that depend on vitamin D being present in order to function properly. So we see things like anti-inflammatory related to immune function effects. We see brain cognitive effects relating to things like mood and dementia and Alzheimer's disease. We see cardiovascular effects. So you've got this whole bucket of your skeletal system, which actually ends up being not just the skeleton, the musculoskeletal system requires vitamin D, but also all of these other things as well. So it's a very important nutrient, but it's not just a nutrient. We have this other really, primary source reservoir of it that is coming from our sun exposure, and then we've got this bucket of supplements that we really need because of our modern lifestyles. Yeah, so it's extremely, extremely important, and I know, Abby, that you would agree with me on that, and I know that
Yep.
you love supplementing, or vitamin D is one of your favorite supplements to use in practice. So, um, who do you recommend it takes vitamin D? And who don't you recommend take vitamin D?
Yes. Um, I mean, first, the simple answer is pretty much everyone. And I know that's like boring and sounds like too good to be true. It's kind of like the
Mm,
red light conversation, honestly. It's like who couldn't benefit from red light
yep.
therapy, right? However, I feel like the individuality is dependent on the person, on their lifestyle, and on their lab work. If people I recommend everyone every 6 to 12 months get a vitamin D test done. Because everyone is so different, their amount of sun exposure is different. The vast, vast, vast majority of people are deficient and at least need a maintenance dose of vitamin D to maintain healthy levels. But some people are so deficient, they really need to do a high dose for a handful of weeks. And then I like to recheck their labs, right? Because some people respond so well to supplementation, they can end up with really high levels really quickly. Some people, it can take months to get their levels to like a healthy optimal level. So the short answer is everyone pretty much. I've seen a couple unicorns in 10 years that have healthy levels without supplementing, but like I could count that on one hand. The vast majority of people have kind of, from what I see, like a wintertime dose and a summertime dose. They certainly might not need as much in the summer months, but I'm one of those people. I need to supplement year round. I supplement more in the winter, but if I do nothing in the summer, even with being outside with my daughter and dogs and all of that, it still isn't enough for me to be kind of optimal. The only people that I pull off is if we pull lab work and they're really high, which that has happened to me a few times with people, especially in winter, especially during the pandemic. A lot of people, rightfully so, the data was very clear that if you have robust levels of vitamin D, you do a lot better with a COVID infection. So people were like, great, and going ham and doubling down, taking, 50,000 IUs every day for a year. And their levels are too high, right? So then you can pull off for a couple months, recheck your levels and find a good maintenance dose. But pretty much everyone needs it, honestly.
Well, that really speaks to what I was saying about, and it illustrates how it's something that we store in the body because it's fat soluble. So yeah,
Hmm.
you can take breaks, and there are different supplementation strategies, and we can maybe talk about what we see in the clinical literature and what protocols you like to use. But I would say, like, the scientific literature is certainly in agreement with what you're seeing in practice. There's no doubt about that. But where things get really kind of murky is, how do we define deficiency, right? Like, what
Hmm.
is the definition of deficiency? And first of all, this raises confusion with respect to, okay, are we just looking and measuring deficiency with respect to how much dietary intake someone has? Or are we going to use those blood levels and use
Hmm.
those as our metric of deficiency? And I think you and I would certainly agree. We want those blood levels to be the reflection of what's
Yes,
deficient. Now, but where things get even more complicated is that even if we look at those blood levels, we don't have a uniform cutoff that is universally accepted by different medical
correct.
communities, and it's all over the map. So,
Well, and the
um,
normal range is like, I mean, on standard labs is like 30 to 80, which is just such a massive range,
right,
right? So
meaning
people are told, they come back with levels at 31 and they're told you're perfect.
yeah,
Meanwhile they're like depressed and have all these other problems. So
yeah,
it's really hard to find a consensus, but like you're saying, that's also everyone is also so different. Like for someone, they might feel great, have a healthy immune response, feel awesome, and they're like cruising at 48. And
hmm,
maybe that's a good level for them
yeah.
versus other people might like really need to bump it higher.
Yeah, it's definitely one of the vitamins where we have the greatest amount of inter-individual variation. But one of the things that I remember reading the statistic and being just blown away by which is if you look at the dietary intake, so that's only vitamin D coming from food, not including coming from supplements. So you start there and you say, what percentage of the population has a deficient dietary
Mhm.
intake? Statistically speaking, it is 94% of people over the age of 1 on the most recent American survey. And
Oh,
that's using the conventional amount of the
yeah,
dietary
right.
that's using the conventional RDA
That's
of
a low bar
600. It's
too.
600 international units a day. So at 600 international units a day, 94% of people over the age of 1 don't meet that 600 level. Now, there is a significant percentage of the population, including children and adult males and females, that do supplement, but that
Mhm.
supplementation range is all over the map. So some are taking 200 units a day, 400 units a day, 600,
Yeah.
all the way up
Yeah.
to, 10,000 or
Yeah.
even more. And then what you're seeing in practice, when you get into looking at what those blood levels are, then again, we end up being all over the map. So if you have two people that are doing the same supplementation protocol, eating the same diet, their blood levels, and specifically what we're talking about are blood levels of 25 hydroxy vitamin D, which is that biomarker of vitamin D that we use as a lab metric. They can be very different from one another, and this has to
Mhm.
do with things like how is someone metabolizing vitamin D? You have protein that transports vitamin D around the body and takes it to different places where important things happen. And that's different between different individuals. So if you're somebody who is missing this vitamin D transport protein insufficiency, you're not going to have high levels no matter how much you intake. There's
Yeah.
polymorphisms of receptors. There's differences, obviously, in people's sun exposure. There's shocking differences related to body weight and how that affects people's vitamin D
Mhm.
status, with overweight and obesity causing a lower level overall. So those individuals can require a greater level in
Yep.
terms of their oral supplementation dietary intake. So the reason I think you're so bang on with telling people this is something that, we can come up with a strategy and I can give you a general recommendation for supplementation, but unless you test and
Mhm.
unless we can look at that number and see how you're responding, it's going to be really, really hard to know what the optimal protocol is for you. Now, I'm curious, what sort of like clinical responses have you seen in practice using this over a decade with your patients? What do you see with respect to how people respond to supplementation?
Okay. I'll go through, let's say, like the top 3, 4 things. Number 1 is obvious for people, immune system. So those people where you hear this goes for adults and children, they get every cold that comes around. They're constantly sick. All winter long, it's like you're sick, you get a few days break, you're down with the next thing. You're around, family that are sick and you always get everything. That's like a low immune response. You get your vitamin D levels up. People are like, this is the first winter in 3 years I haven't really been sick. So that's a huge indicator, even without testing, if you or your child are the people that are always saying they're sick. Start taking a vitamin D supplement, get your levels checked, get it higher than like 32,
Mhm.
and just monitor that. Another huge one that isn't talked about enough is mood stabilization. So, depression and anxiety. It's the sunshine vitamin. The sun makes us happier. Vitamin D makes us happier. And that's a big one, especially for seasonal depression folks. We talked about this a little bit on the seasonal depression podcast with Allie, but a big one to address that people forget about
Yeah,
a
absolutely.
lot.
And I mean, from what I've seen, that's entirely consistent with the scientific literature. So
Mhm.
what is pretty remarkable about vitamin D is it actually has been subject to some pretty rigorous clinical trials, some of which were massive and extremely well funded. And it's a it's a bit complicated to dig into Because when you do look at all of these studies, you see that, you know, they're confounded and it's difficult to compare them one to another. Certainly some of them were better conducted than others. But with respect to the clinical outcomes that we've looked at, like you mentioned the depression studies, and yeah, the depression that you're seeing in practice, and there are studies that absolutely support that. There was another really interesting cognition study that I saw where healthy adults that took vitamin D showed improvements in memory from supplementation. So they weren't necessarily showing cognitive impairment, but they nonetheless showed improvements in memory. Most of the studies on vitamin D early on really focused on that bone mineral density outcome. So if we break down the mechanism of how vitamin D affects your bones, what's going on is that it increases the absorption of calcium from the gut, and then through effects that involve vitamin K, you transport that calcium to your bones and your teeth, and then you get stronger bones, you get stronger teeth. So a lot of studies were, first of all, looking at, okay, can we supplement with vitamin D and improve things like bone mineral density and decrease the risk of fractures? And again, the studies have been challenged by methodology issues. So for example, they almost never include vitamin K. So most of the studies of
Right.
vitamin D supplementation didn't include vitamin K. Now, they got better at making sure that they supplemented with calcium as well, because if you take vitamin D and someone still has low dietary calcium, well, then that calcium's not going to get, like, there's no calcium to absorb, right? So
Right.
you're not going to have bone benefits. And then, as you mentioned, like, a lot of your response depends on where a person is starting from. So really, when you do a study where you want to look at what the supplementation outcome is, you want to know exactly what their vitamin D status is at baseline. And that's not always done consistently in the literature either. But despite these issues, we still see a lot of research that shows bone benefits. We see research that shows improvement in the teeth. Like, so for example, decreased dental cavities. There's some infection research that shows, as you mentioned, COVID, for example, like a reduced incidence of viral infections. Absolutely. There's also some really interesting cancer research. So cancer studies in terms of the incidence are hard to do, right? Because it takes a long time for cancer to manifest as an outcome. Most clinical trials don't run for 10 years, you know? That being said, there have been some studies that have associated vitamin D or have demonstrated that supplementation can reduce the incidence or is associated with a decreased incidence of a few different types of cancer, which isn't surprising because the immune system is what manages the
Correct. I was going to say
development of
it's an
cancer.
immune
And
system
exactly.
disease.
Exactly. So if you look at that as an outcome, it's not surprising. Improved biomarkers like C-reactive protein. So again, relating to the immune system and inflammation, supplementation with vitamin D has shown that people have
Yeah.
shown benefits in blood pressure, like reduced blood pressure. There have been some broad studies that have looked at like just general mortality and have found a decrease in all-cause mortality associated with supplementation.
That's what
So yeah.
I wanted to speak to inflammation too, because and see what you had to say about the literature, because I've seen with some patients too that were under the let's say it's like a woman in her mid 40s is like, "Oh, I
Mhm.
think I'm starting to get like arthritis in my knees. Like I'm having this weird joint pain." And we get their vitamin D levels up and it goes away completely.
Yeah, yeah. So there's definitely, and I mean, it just studies looking at C-reactive protein. It's a very simple, biomarker for inflammation,
Mhm.
has shown a reduction in clinical trials of vitamin D supplementation. Polycystic ovarian syndrome is another one that has
Mhm.
shown benefits to supplementation. And so I know you've done a little bit looking at some of the literature on women's health and vitamin D supplementation, and it's pretty remarkable.
I mean, a lot of people refer to vitamin D as like it almost acts more like a hormone in the body.
Well, it is a hormone in the body. Yeah. Yeah.
Yep.
So when it comes
Like it's
into
not
the
only a
body,
vitamin, you know.
no, that's why I said it's a confusing, it's almost a misnomer to call it a vitamin, because
Yeah.
so you've got when it's synthesized in the body through sun exposure, that's not a vitamin at all, right? The vitamin part means that it's a micronutrient coming from the diet. When that comes in, it undergoes these hydroxylation reactions that actually make this hormone. And the hormone is what triggers these biological effects. So, really, when we get to looking at, like, okay, what is vitamin D doing in terms of its actions in the body? Well, by that point, it is a hormone. And so technically, that's the correct thing. That's the correct term to use once you get to that stage. But if you're looking at it
Mhm.
from a dietary source or a supplemental source, the correct term to use would be vitamin D. And of course, there are molecular differences between what those molecules look like. So, yeah. What do you recommend for protocols for your patients then? We've talked about differences related to what people's baseline blood levels are. But do you have a standard protocol that you like to go to?
Um, it of course depends on the person, but I would say if I'm making generalizations, on average, I'm having adults do like 5,000 IUs a day. I feel like that's a really good therapeutic dose that will slowly, for most people, raise you over time, but not too aggressively. So if they're in a winter climate, you're indoors quite a bit, you're probably low on vitamin D. That's a pretty safe dose to take. And that's kind of the equivalent of what we made our DK product at. Some people less, some people a lot more. I do pretty aggressive high dose protocols with patients that are really low, but I only do that if we see it on blood work first.
Hmm.
And then I'll put them on whatever protocol. Like I've put people on 20,000 IUs 5 days a week, take a couple days off, do that for a few weeks, 4 to 6 weeks, then recheck labs, then see where you're at. And then we know if we need to stay high, potentially go higher or back off. But that's more based off of not just their number, but also their symptoms, right?
Hmm.
I'm not afraid to go pretty high with someone if they're sick all the time, have no energy, feel terrible, and they're 18
Yeah.
on blood work. I'm like, I want to get you feeling better in 2 weeks, not
Yeah.
2 months, right?
Absolutely.
So I'm going to be a lot more aggressive in that case. If someone's cruising at 32 and they're like, I feel pretty good, but I know that's not optimal, we could do a 5 to 10,000 IU
Hmm.
likely and, have a little bit more of a gentle approach.
Yeah. No, that makes perfect sense. And when I kind of look at that relative to what's been done in the clinical research, it's totally consistent with what the approach that some researchers have taken, where they've done this like higher bolus, 50,000 IUs, 10,000 IUs. I've even seen one study that was 100,000, and maybe they're doing that like once a month kind of thing. So it's
Hmm.
there isn't a standard protocol in research, and it doesn't sound like really that there's going to be a standard protocol in clinical practice, right? Like you're
No. And
going
I
to.
think as long as you're monitoring and testing, it's fine. I mean, my folks that are real low, I'm not above I'll do like 50,000. I use 3 days a week and take the other days off.
Mhm.
Give your body a break. Kind of mimics more like having a day at the beach. You get a ton of sun
Yeah.
exposure. You're probably not doing that like 7 days in a row. So
No.
you give your body a bit of a break. Works really nicely. Huge disclaimer, do not do any of this without consulting your physician first, right? I only do this with patients I'm working with directly in practice as
Mhm.
a patient with lab testing results and all of that. Had to
Yeah.
throw that in there.
Yeah, no, for sure. I think a very, very crucial number that for people to kind of have awareness of is what is the synthesis, which is going to happen in through the skin from the sun exposure. Like if you're out in the sun, and we used a lot of this rationale when we were developing our product, our vitamin D product, and that's okay. So you spend a day at the beach. How much vitamin D are you going to synthesize in your skin? What's the equivalent in terms of
Hmm.
dosing that's coming in orally? And that comes in at ballpark is around 10,000 units, because when you have this exposure to the skin, like it's basically a chemical reaction, which takes a molecule that's already present in the skin and it turns it into something else when it gets exposure to UVB
Hmm.
rays. But for those people who have studied chemistries, you know that you're limited by the availability of how much of that chemical is there. So you're going to reach a point at which you can't go, you just can't
It
make any more
stops.
from the sun. Yeah. So we've got this like built-in kind of regulatory check mark from sun exposure that we actually don't have from dietary exposure or from supplementation.
Right.
Yeah, and this is where, you know, there were for many years a lot of talk about excessive vitamin D exposure, vitamin D toxemia, and what's going to happen from that. And certainly over the last 10 years or so, we've realized very, very, very rare, even with supplementation protocols of, you know, 10, 25, 50,000 done properly using monitoring under a you know, a physician's supervision, you just really very, very, very rarely see side effects from vitamin D
Yeah.
supplementation. Yeah. And
Even people that they come back and their levels are crazy high, they don't feel bad.
yeah, oh
You
yeah,
know, it's like,
absolutely.
okay, you've overshot. Let's
Yeah.
back off. You know,
Yeah.
they're not like in grave danger.
No, they don't have hypercalcemia, which is like
Hmm.
excessively high calcium in their blood, which is what was thought to be the
Mm,
potential, you know, harmful consequence. Just don't see that. The other number that we really zeroed in on as being kind of like our target, you know, you'd mentioned that 5,000 units a day. There was a series of research studies that were conducted where we ended up with this kind of loose consensus in the scientific, certain members of the scientific community, but in the traditional scientific community,
hmm.
where they concluded in a publication, a scientific publication, saying that they think that most people would benefit from supplementing with around 4,000 international units a day, you know, give or
Yep.
take a bit. And so I think that target makes a lot of sense given what we know about exposure to vitamin D from the sun being at around a
Hmm.
maximum of 10,000 units per day. So that gives you room to take in some from your diet. It gives you room
Yep.
to make some from being outside. And it's entirely consistent with, you know, what you say, like how people are responding in clinical practice. So it definitely does make sense for people to know these things and be educated and have an awareness of what numbers are, because it is pretty easy to, you know,
Right.
overdo it with supplementation, just like it's quite easy to underdo it. So, you know, especially if you're buying like a multivitamin that has vitamin D incorporated into it,
It's like
oftentimes
never
that will,
anything.
yeah, it will be an inadequate value, even though
Hmm.
the number on that supplement fact table tells you that it's 100% of your daily value, for example. Like
Yes.
you know, it's right there. So yeah,
Yeah.
I mean, as you know, we're always trying to educate people and get them to really understand, you know, where does this number come from? So we're
Yeah.
talking about, obviously, we've mentioned we ended up formulating our own vitamin D supplement. Can you tell us, because you've worked with a lot of different products in your practice over the
Hmm.
last 10 years, some of which you liked a lot, but yet you still felt pretty strongly about wanting to develop a not a new product, and you thought there was room in the market for something that kind of came at things a little bit differently. So can you tell us about how our vitamin D supplement is unique and kind of what needs it fills?
Yes. So there's a few different reasons. I think the most glaringly obvious one is that it's water soluble. So
Hmm.
if you guys look at the vitamin D product you might have at home, unless it's ours, which if it is, we love you for that. But we talked about how vitamin D is fat soluble. It's an oil-based supplement. It's usually a tincture in a dropper or in a capsule. And so you'll be able to see it's like this yellowish liquid inside. What that means when a vitamin is fat soluble is it's a lot harder for our bodies to absorb it, right? You lose a lot of that absorption through your
Yeah.
natural, digestive process. It's a fat, right? A lot of people know same thing applies with fish oil. People take fish oil, they get the fish burps because you can't break it down well, right? So the same thing happens with vitamin D, which is part of the reason why people have to take crazy doses like 20,000 IUs to get their levels up. And then so many people I see in practice over the years, our guts are struggling. We don't absorb, like, our guts don't even digest things well, let alone a fat. And so people are having to do higher doses than ever, and it's kind of hard on their system. And so we've made a fat-soluble vitamin, a water-soluble vitamin. And so what that means is you have to take around half the amount to get the same effect. Vitamin D is also kind of pesky, like you have to take it with food. You have to take it, with food with fat, preferably. A lot of people take their vitamins on an empty stomach when they're running out the door in the morning. That's just reality. It's what it is for a lot of people, or they forget. I know this after 10 years of seeing people and being like, can you please take your supplements with food? And people skip breakfast and fly on coffee and run out the door. So this solves that problem. It's tasteless. They can put it in, their beverage of choice and a little bit of water. They can mix it into food for their kids or a smoothie or even just their water and get it really easily. So the water soluble technology, I feel like, is the biggest differentiator. And then the other one that blew our minds that I didn't fully realize, I don't think either did you, is that most vitamin D is made and extracted from sheep's wool, which is called lanolin, which is kind of gross if you think about it too much. And so we sourced our vitamin D very differently. It's a vegan source made from lichen, and the vitamin K2 is also not synthetic and is made from a Japanese food called natto. So it's also vegan. So the vast majority of vitamin D products, just so you guys know, are not vegan,
Yeah.
which I feel like not many people are aware of.
No, they're not aware of it. And I remember when we were working on this formulation, I really felt like we came up against a roadblock when we realized that the source of vitamin D3 specifically, because vitamin D3, I didn't talk about this, but we have two forms of vitamin D in food. We've got
Mm-hmm.
D2 and D3. D2 is found in things like mushrooms, so
Mm-hmm.
some plant food, and then D3 is the animal source, so it can be found in things like egg yolks and liver.
Yep.
So we've got these two forms, and when you do research looking at how bioavailable these two different forms are, meaning when you eat it, how much of it actually gets into your body and
Mm-hmm.
will increase that level of 25 hydroxy vitamin D, there is a difference between D2 and D3. D2 is not useless. It's absolutely a useful molecule, but it's not as good at raising vitamin D blood levels
Mm-hmm.
as D3. So we wanted to make our product accessible to everybody, whether you were vegan or not. But we also wanted to use vitamin D3 because that's the one that's more bioavailable. And so we found this lichen source, which fits ticks all the boxes that we wanted to tick. And as you said, like our priority and value is to make things food based as
Mm-hmm.
much as possible. And this is something else that people don't know about the supplement industry is almost all of your vitamins are synthetic. They're not
Yep.
sourced from food and they are not made in the USA either. So it's
They're
very,
in the
very
lab in
difficult.
China.
They're made
That's
from a
the
lab in
reality.
China. Yeah,
Yep.
yeah. So certainly there are still times where I find myself needing to take something, and that's the only source that's available because we haven't made it
Mm-hmm.
yet. But that certainly
Yeah.
it was an eye opener to me. I had no
It really
idea.
is.
It really was an
Like
eye
all
opener.
your B complexes, multivitamins. That's what it
Yeah,
is.
it
It's
yeah.
not real, unfortunately.
No, it's not
And
food
listen,
based.
not to say that stuff doesn't work,
It
right?
does. Yeah.
You can start a great quality B vitamin synthetic, because you have low B12, and a few weeks later your B12 is going to be great. So, better like than having a deficiency, certainly. But it's really mind-opening to learn that stuff.
Yeah, yeah, it's kind of a good, better, best scenario
Mhm.
where we're
Mhm.
trying to do things in a different way. And
Yep.
we thought a lot about dose and we went back and forth. So let's explain to people the science of this water solubility issue. And I'll talk about it in terms of numbers because you talked about it
Yep.
with respect to absorption. So as Abby was saying, when you take something that's water soluble, it's able to get into the body through the intestine much more readily than if it's a fats require transporters and it's just a much harder process to go through. So what this means in terms of numbers is that if you take a supplement that has 2,000 units of vitamin D and you measure the change in the 25 hydroxy vitamin D in the blood, what you see is that it's approximately comparable to that number that we saw as the target in the scientific
Mhm.
community of around 4,000. So it's around twice as bioavailable. And that's something that is a bit challenging for us to get across to our customers, because when you
Yep.
look at our supplement facts, it will say that we are in one scoop, it's 2,000 international units of vitamin D. But in fact, that 2,000 international vitamin units of vitamin D is the equivalent of around 4,000 of a traditional supplement that's
Yep.
not water soluble.
And it's
Yeah.
2,500.
Yes, it's 2,500 exactly. So we went for that number that you were seeing in clinical practice, that we're
Yep.
talking about with that ballpark of 4,000 international units of being kind of that scientific consensus, give or take 1,000 or so. So yeah, we really thought long and hard about how much to put into this.
What dose it should be. Yeah, and then because part of the other reason is we really wanted children to be able to safely use this product, and we could have children dosing that we felt good about, saying, yeah, young kids can totally do a fourth of a scoop of this, no problem, and get
Yeah.
their daily vitamin D. And then I would say the other big thing is in a lot of other water soluble formulations, because obviously it takes a bit of work to take something from being an oil to being a flavorless powder in a jar. We used like really, really clean ingredients that I've never really been able to find
Hmm.
elsewhere in a water soluble product. So in a lot of water soluble products, you'll see maltodextrin, you'll see citric acid, you'll see silicon dioxide, you'll see all sorts of like kind of funky stuff. And we were able to do it with chicory root inulin, MCT oil, and licorice root extract. And
Yes.
that's it,
Yeah.
which is
Exactly.
pretty amazing. Yeah.
Yeah, it is. It is. And you talked about our vitamin K. And I've mentioned before, when you look at the studies of vitamin D supplementation and how so many of them, like literally almost none of them, used vitamin K
It's
along with
pretty
it.
wild. I mean,
It's
I guess it
wild.
makes sense, but because they're trying to really just look at D, but
That's the rationale, right? The rationale. But it's almost dangerous, especially
yeah,
if those levels of supplementation were in the thousands, because the
right.
vitamin K is needed to make sure that any increased absorption or any calcium that gets absorbed is going to end up in the bones and the teeth and
Hmm.
not get deposited in your cardiovascular system. So it's really like, if you're going to be supplementing with vitamin D, you need to add that additional vitamin K to make sure that you don't end up with, calcification in the vascular
Yeah.
system.
Now,
Like
I have a
it,
question about that, though, Dr. Jen, because I know there's not really an upper limit on vitamin K2.
yeah.
So, what does the literature say? Like, say someone is taking 25,000 IUs a few times a week to really raise their levels, would just
Hmm.
be supplementing with like a normal daily dose of 100, 150 K2 be enough? Or would you
Hmm.
also need a super elevated dose of vitamin K to complement?
Yeah, no, you shouldn't, because you have to think about it this way, right? What that K is for is to get an the calcium to
Hmm.
where it needs to go. If you're not taking, if you're not changing and also doing this like radically high calcium supplementation, that's not going to
Right.
be an issue, right? That number is going to stay constant. So as long as you have, a couple hundred um, vitamin K units,
Yeah, like ours is
you should be
130
okay.
micrograms, right?
Yes.
So it's
Yeah.
like
So that along with
some
food,
patients, they're doing
you're going to
such
be.
high dose, they might take their provider might give them like a pill that's like 50,000, right? So they
Mhm.
could do add RDK2, get the K2 you need, which will help that issue.
Yeah, yeah, and it's a very safe supplement. So,
Yep.
but certainly, like, it's just to cover your bases kind of thing, to make sure that it's included in the supplementation.
Yes.
And if you are taking, like, I think a lot of people don't understand calcium supplementation very well. And the main point about calcium supplementation is if you're going to do it, which certainly it's warranted for some people, you just need to make sure that you're never taking more than around 200 to 300 milligrams at a time,
Mhm.
because that's a bolus or a bulk dose of calcium that really exceeds what your body would normally see. And because calcium is it's very biologically active and it can get deposited in the cardiovascular system. If you were wanting to supplement with higher levels, you'd want to break those supplements up into maybe 2 doses
Yeah.
a day or 3 doses a day. And I mean, we certainly get asked sometimes by people, like, should I take calcium along with your vitamin DK? And I mean, I think it depends on the individual, and that requires an analysis of what their diet is like, what their weight-bearing exercise status is like. But certainly for people who don't
All I
consume
can
any
say
dairy products,
is
yeah,
I've seen so many people that are told by their primary care
1,000
that their
milligrams a
bones
day.
are terrible
Yeah,
because so they need calcium, and they're chugging these synthetic calcium pills from
yeah,
CVS that are literally chalk in a
yeah,
pill.
yeah.
And then they're
Usually
having
5.
heart issues and
Yes.
their bones are still suck. They get a
Yeah,
and it's like when you get them on D&K or even a
yeah.
just smarter bone supplement that has a lot of minerals in it
Mhm.
and other things that actually build their bones actually get better and start doing weight bearing exercise. So I'm like,
Yeah,
I think it's hard to find someone that has a true calcium deficiency.
yeah.
I'm sure it's out there, but I don't think it's as common as everyone's told, like, as you age, you need a calcium supplement, and I think it's caused so many problems.
Well, I mean, see, the challenge is that there's not, like, there is a definition of what the dietary intake is supposed to be, but
Yeah.
when you look across populations and different regions in the across the globe, first of all, there's a huge variability in dietary intake, but there's also
Mhm.
variability in terms of the recommendations. So our recommendation in North America is quite high. There are recommendations that are in other parts of the world that are not nearly that high, and so I
Hmm.
just don't think we have clarity about how much the body needs. And it does relate to
Right.
what you were talking about. Like, it's this complex pathway that involves vitamin D, that involves vitamin K, that involves all of these other minerals that are needed for structural integrity of our bones. And so just taking 1,000 milligrams of calcium, in one sitting, or, even two sittings, it's not an advisable supplementation strategy
You
from
would
a
never, like, eat that in
cardiovascular.
real life,
Never,
right? And
never.
this goes back to our last podcast we did of we should also be getting calcium from our water,
Yeah,
not just
yeah,
our food,
yeah.
right? And so it's just like all the minerals, all the more we read, right? Go figure, everything works together, right?
Mhm.
So whenever you're just like high dosing one mineral or one vitamin, that's probably going to come at a cost long term.
Yeah, no, I agree completely. And so I think, as we've talked about today, we've really shown, I think, the rationale for why we developed our product the way that we did, how it's consistent with what we've investigated in the scientific literature in terms of absorption and dosing, the clinical outcomes that people can expect, the formulation with vitamin K. Um, is there anything in kind of closing that you think people should understand about, you know, supplementing with vitamin DK on a daily basis or on a regular basis?
I think the biggest thing is just the reality of our modern world, which this is the case with our three essentials products, is that the vast majority of people can benefit and should probably be consuming a vitamin D product. And if maybe you've been consuming a different product that's lower dose or not as high of quality, to try out our product and see how you feel. Take it every day for 30 days, get your vitamin D levels checked, get your levels up. I think we say officially in our blog, try to aim for between 40 and 60 in that range.
Mhm.
See how you feel with your vitamin D levels at 55 versus 30. Most people notice a massive difference, before getting in the weeds and trying all the other, maybe herbs and things like that to stabilize your mood. Like start with the
Yeah.
basics, in my opinion, solve like 80% of people's problems. And
Yeah.
vitamin D is such like a no-brainer that impacts so much in the body.
Yeah, no, I agree completely that we had that conversation last time about just deal with the foundations first and make sure that you've got those bases covered. And then if you
Hmm.
need additional supplements on top of that, that's when you can be sure that you're giving your body what it
Yep.
needs. Yeah, under those circumstances. Awesome. Well, thank you for chatting with me about all of this today, and hopefully soon
Thank
we'll
you.
be out of winter. But
Yes.
as you mentioned, even I personally have a summer dose of vitamin D and a winter dose of vitamin D,
Hmm.
and I have a vacation dose of vitamin D when I go to the beach.
Yep.
And the
Yes.
only way to know really what you need is to test. And thankfully, we have those tests available
Yep.
that are now easy to use, which is great.
Yep. Totally.
Mhm.
All right.
All right.
Thanks,
Well,
Jen.
thanks. Well, thanks everybody. Thanks for joining us today, and we'll look forward to seeing you next time.